Hello and welcome back to my channel Inspire with Anushka. Guys, how are you? Hope you all are fine. Guys, actually we are discussing about the topic disease, in which we have discussed about the different type of diseases just like the communicable disease, non-communicable disease, and how they are spreaded and how can we preserve them and how can we prevent ourselves from this. Sorry, I told that preserve. We don't have to preserve any disease inside our body, because it will lead or create a huge problem. Okay, so guys, we just have to prevent them, and we have to also look that how can we treat them. So on the way to conclude the chapter, we are going to the topics just is like that, the vaccination and vaccine. Today we will discuss about this topic. So do you know what is vaccine? Vaccines are the actually antibiotics which you have given during the birth time for that type of disease which once occurs in the life, it doesn't occurs again. Once you will get recover from that, your body will become resistant from that disease couldn't never occur inside your body. So it's a proper way, it's a normal condition in which during the birth time we have just to inject that the antibiotic or that virus which created that disease, and if your body make themselves resist against that disease during the birth time, then for the lifetime you are secure from that disease. Whenever you will come in contact with that person, you will never get that type of disease again in your life. Okay, so this is the common principle of vaccination. So let's start the topic. It was Edward Jenner who first developed the technique of vaccination in 1798. Okay, this was as a result of the 26-year study of two diseases, that is called cowpox and smallpox, which was a most common disease at that time. Okay, so cow is called the vacca in Latin word and complex as vaccine. That's why from this word the Edward Jenner or the Pasteur developed the term vaccination or the vaccine. So we have seen that how in the historical time that how the vaccine was made, and for what disease it was first discovered, and how it got its name. Okay, so let's discuss that what is vaccine. A vaccine is a suspension of disease producing microorganism which is modified by killing or weakening, attenuated, so that the suspension will not causes the disease. Rather, it stimulates the formation of antibiotic upon the inoculation. The antibiotic remains in the blood for long, and when the germs of the patient disease enter the body, the antibiotic destroys them. Okay, this is the basis of immunization. And you know what makes your immune system strong? That's the WBC, white blood cells, which are responsible for creating the your immune system more strong. It has just the lifetime of 4 to 5 days, but it is the cause which is responsible for making you disease free, which always aids the unknown viruses or unknown cells from the body. Because if you get affected with any bacteria, any virus, it will just kill them and eat them. White blood cells are very essential just to enhance your immune system. Okay guys, so we have to see here some common vaccines, that is called the DPT vaccines, for protecting against the diphtheria, whooping cough and tetanus. Okay, we have also the BCG vaccines for preventing against the tuberculosis. We have the polio vaccines, just oral polio vaccines, or the oral polio drops are also available nowadays. The thyroid vaccines, just to prevent against the thyroid, the TT vaccines against the tetanus, and the measles vaccines just to prevent ourselves from the measles. So these are the vaccines which are provided during the birth time just to prevent the this type of diseases for the lifetime. If you take the vaccine, this type of disease will never occur. Okay, so there are some schedules for the immunization which you also must have to know, that is the pregnant women of 16 to 36 weeks, they have to take the tetanus 2 at the interval of 4 to 8 weeks. Okay, and in infants, which is newly born baby, they have to take from 3 to 9 months DPT, polio, BCG, and the 3 doses at the intervals of 1 to 2 months. Okay, so 9 to 12 month में बेबीज़ को लेना चाहिए measles का एक टीका, और 18 to 24 मंथ्स में DPT का एक टीका और पोलियो का एक बूस्टर. ओके, और children's which is up to the age of 5 to 6 years, they have to take at that time the 2 vaccines of typhoid, and the children's of 10 years must have to take 1 booster for the TT, it means tetanus, okay, and typhoid. Okay, and in 16 years also they have to take a vaccine for the tetanus and typhoid. Okay, so this is the schedule of immunization in the during the pregnancy time, which is occurs during the with the pregnant women and the newly born babies. Okay guys, so this is all about the today's topic. Hope you all have enjoyed and liked it. If it is giving you any point of information which you don't know, then please guys, please, I request from you all that please press the like button, share it with your friends, and subscribe my channel. Thank you so much for your love, concern, and I want your support. Please support me. Thanks guys.